TacNMed here. If you're new to the channel, you'll notice that we have two sides of the channel, one being the tactical side, such as gun and gear reviews, and then the other side is the medical side, which is based on emergency medical situations when no other help is available. So today we're going to be looking at how to do a basic suturing technique when no other help is available. The supplies that you'll need for this, the minimal supplies, include a suture, some type of antiseptic, which could be iodine based or alcohol based if you have nothing else, gloves, gauze, and a water supply. The steps we're going to be going over includes assessing the scene, creating a sterile field, cleaning the wound, stitching the wound, and then covering the wound. Some background for this: maybe you're hiking and one of your friends is injured, you're miles away from any help, and he's not going to be able to make it out unless you stitch the wound and stop the bleeding. So looking at the different supplies, this is your common suture. There's different sizes. They can be ordered online or maybe bought at certain medical supply stores. So opening the suture up, take off the plastic covering. Then to remove the suture, all you do is tear it open, then take it out, and you'll see this little dotted line here. If you tear right along that, what's going to come out is your needle. Careful with that. With all your stitching thread attached. You can just remove it like so. So there's your full suture. Some other supplies are the gauze. You might have pads like this, which are pretty common in just general first aid kits that you buy at the store. You might have a roll of gauze like this. And these are some of those pads taken out. Okay, so starting with the steps again, assessing the scene. As any first responder would tell you, or probably should tell you, is when you walk onto the scene and you see your buddy or friend injured, you might want to just run right towards them, but you really need to look around and make sure that the scene's safe for you, because you're not going to be able to help them unless you can get there safely. And next we're going to create a sterile field. What we'll be using for the demonstration is a pad that's supposed to be a similar texture to skin or human tissue. I've already created a laceration within the pad. So optimally, you'll probably have some type of iodine-based solution. They sell it in a big bottle at drug stores. And you can just put some of that on your gauze and then wipe down the field. I'll just be using an alcohol pad for this demonstration. So just go around and you want to clean all the way around the area. If this is on a leg or something, of course you'll want to do clear around the leg. You want to sterilize as much area as you can, because that's the area that you can lay your supplies on and work on. If you have some type of backdrop like a plastic sheeting, you can lay that down beneath the leg in order to keep it off the ground and keep any dirt or anything getting in the area. And this kind of goes into step 3, which is cleaning the wound. So when you look at the wound, there'll probably be a lot of blood in it, so that's what the water supply is for. You might have to rinse it out. And then you want to make sure that you clean inside the wound all the way around. If you see any dirt or anything inside the wound, you want to keep washing it out with water and try to get it until you get it all clean. Now our wound's clean. We can begin the 4th step, which is stitching the wound. There are a lot of supplies available for you to use when you're stitching. Surgical tools such as forceps and surgical scissors that you can use that help a lot. For this demonstration, we're just going to be going by hand, just because you may not have those type of tools with you, and I want you to be able to do this without them. So looking at the needle, you'll see it has a curve to it, and this is to help you with the technique of getting the needle through the wound. You want to hold the needle towards the end, not by the point, but towards the end. And when we're stitching, we're going to be using a rolling technique, which is you don't want to go in sideways, but instead you want to arch your hand and make the needle go directly down into the tissue, and then you just roll your hand to make that needle go through the tissue. So starting with the first stitch, we want to start up towards the top. We want to just take the needle down, and through the stitch, through the tissue. And we're going to do that roll, bring it up through. Sometimes these sutures can be a little tangled when you just pull them out. But what you want to do is pull all the way through, leaving just about a little over an inch or two at the end so you can do your tying later on. You'll notice that with this first stitch we only went through one side of the tissue. You see it went down through that side, through the middle, and then out through the middle of the wound. This way, instead of going through both sides at the same time, we're going to be able to make sure we get our depth right and that we're going through the tissue around the same area on both sides. If we do it all at the same time, you're more likely to rip the tissue by not getting enough depth on both sides of the wound. So we're going to do the same thing on the other side, but this time we're going to be going in through the center of the wound. Rolling the needle, coming up out. Then we're going to pull so that the thread's through both sides. And what you have is a stitch through both sides, and you'll see the thread down in there in the middle. Now we're going to go on to tying the first stitch. So this is when certain surgical tools are going to come in handy, but if you don't have them, you can do it by hand. How we do this is just take the thread, wrap them around the fingers, just one loop through. Then you're going to grab the other end that we left with your fingers, kind of just pull it on through. You just want to pull tight enough to make the sides of the tissue come together. You don't want to over tighten or you can rip the tissue. Now we're just going to do that a few more times. This is something that's a lot harder to do by hand because it's so much more bulkier. But we just wanted to try it because it may be all you have. Again. We're only going to do 3 knots for the demonstration, but you can do 5 if you want, and you also need to make a judgment on how much supplies you have. If there's a chance you might have another injury in the group, you don't want to use all your supplies on one person if you might need them again. Notice that the stitch is offset of the wound, This will make it a lot easier to remove later on, and sometimes it can help tighten the wound better when you offset the stitch. The next one, of course, will offset it to this side. Now you're going to need something to cut the suture with, the excess. You can either, if you have a penknife with you or a pair of scissors like this, just cut both sides. Leave just enough on the side, just a little bit on the side, and that'll help keep it from untying. And we're going to continue that process all the way down the wound until we get it completely stitched. This is an example I did earlier. That's about the same size wound, and this is about what it would look like when you're done. You see each knot's kind of offset of the center. For this one it took 5 stitches. And that's kind of a judgment about how well you're closing the wound, how many you're going to need. May need more, may need less. So after you have the wound stitched, the final step is covering the wound. So if you have a bandage available, you can just place a non-stick bandage over top of the wound. If not, you could put some gauze over top and then cover that with tape. Just anything that's going to kind of cover the wound and keep anything from getting out, any debris getting inside of that, because that can increase the chances of infection significantly. So I hope this was helpful. If you have any questions, you can leave a comment or a message, and continue to watch the channel for more medical and tactical reviews. Thank you.